I am the brand manager from Kamina company. My name is Hazar. We are here today to talk about very special products, and it is very well known in the market. Of course, you have all heard about Cystiphane. We have a full range for hair care. We have anti-hair loss and anti-dandruff range, as well as two new products. Actually, one of them is new. One of them was out of the market for a while, which is Ionel Tea. And we are here to tell you that now it is back, and we want to make sure everyone is aware that it is back, and we want to focus on it as well. First of all, we're going to start with the hair loss range. Please stop me at any time if you have any kind of question or if something is not clear. We're going to go a little bit medical and with the selling points as well. Okay? Not any kind of hair loss is meaning that we are suffering from a medical situation, because it is normal to lose hair every day. Up to 100 hair per day, or strand we can say, that is totally normal. Between 50 to 100 hair, it is considered normal hair loss, because our hair goes through cycles, and each cycle will take a while, and then the hair automatically should fall down, so a new hair should grow instead. So until 100 hair per day is considered still normal. After 100 strand per day, then we can consider the condition as a medical condition where we need to use a solution, supplements, or topical solutions. These are the main important parts of the scalp. Mainly, we have the frontal part, which most men start to suffer from hair loss at this area, and the vertex, which is the back side as well. For women, we start losing hair on the sides mainly. This is where we start noticing the hair is thinning, especially here, these two areas. And it goes back until we reach the occipital part. The occipital part is where we take the hair follicle, and we can do from that the hair transplant procedures. So we usually take from here, this part, and then we do it here. Okay? So this is in case of hair transplant procedures. But before we reach to that stage, we can try a few solutions instead of going to severe cases of hair loss. So as I said, the hair usually goes through stages, and we can say it's like a 3-cycle journey. The first stage is called anagen. This is where the hair grows very thick and very healthy, and it lasts from 3 to 6 years. And then it goes to the second stage, which is called the catagen phase. It lasts for 3 weeks. Here, where is the roots start to feel a little bit weak, and we call it degeneration, where the roots start to push a little bit to the upper side, and it goes to the telogen phase, which is 3 months, and here where the grow stops completely. So the hair does not grow anymore. There's no more nutrients from the hair follicles, and this is where it falls down, and the hair follicles start to have a new baby hair, and it grows as a new healthy hair, and it goes to the anagen phase. This is why we said until 100 strand per day, hair loss is considered still normal. Hair loss is actually one of the most serious hair problems that affects men and women, and 90% of the population have suffered at a stage of life from hair loss, or will suffer at a certain age, whether it's men or women. So the most common type of hair loss is called androgenic alopecia. And as I said in the previous slides, for men it starts in the frontal side and in the back vertex side, especially during puberty. This is where it starts, and it progresses gradually, and it affects 50% of men over 50 years. This is different from women, where they actually suffer from hair loss mainly during menopause and after 40 years old. As I said, 45% of women suffer from hair loss after menopause, while as 50% of men suffer from hair loss from 50 years old and above, and actually it starts during puberty due to hormonal changes. We have a few factors that can affect or increase the hair loss. It is internal and external as well. Internal factors can be genetics. This is the most common reason. So if your grandparents or parents, they suffer from hair loss, you will mainly suffer as well at a certain age. if you don't take the needed precautions. So genetics is the main reason. We have the menopause, of course, stress, certain medications, diet, iron deficiency, hormonal changes. After birth, this is where we have to focus mainly for women, and thyroid problems. When it comes to the external factors, of course, smoking is the most important factor. Humidity, heat, especially in the Gulf area, pollution, sun, low quality hair, and hair products, and poor nutrition, as we said. Of course, when we suffer from severe hair loss, it doesn't look nice, and it causes, for some people, anxiety, depression. It affects the self-confidence, especially in our working place. And mainly, we think that women suffer more from hair loss, but that is not true. But the difference is that women care about their hair more, or they care about the appearance of their hair more than men. But nowadays, anyways, both men and women, they still care about the appearance, and they wouldn't like to suffer from, looking less attractive or finding difficulties in the social and professional relationships. This is the emotional part of the hair loss. This is where our solution for hair loss comes, and we have our tablet, lotion, and shampoo. This is actually our new formula, but still for now we still have the old pack, which is in the brochure, the blue pack, which is called Cystiphane, before Cystiphane 4. Shortly we will have this in the market as well. But for now it is the blue pack with the lotion and the shampoo. So for Cystiphane tablet, we are special because we have the highest concentration in the market of cysteine. What is cysteine? Cysteine is an amino acid derived from keratin. And why do we focus on cysteine, not keratin? Because some other products, they already put keratin in the supplements, and that's it. What is the main importance of cysteine compared to keratin? This is a nice information to have. Usually, keratin is very hard to be absorbed in our blood, okay? So cysteine is derived from keratin in a much simple form, and it makes it easier for our bodies to absorb it when taken as a supplement or systemic medication. So in terms of absorption, if we compare cysteine to keratin, cysteine is much easier for our bodies to absorb, and which results in faster results. Second thing, cysteine is plant-based. So the origin of cysteine is from plants, which makes it suitable for vegetarian people. It is gluten and lactose free. It doesn't cause weight gain. Why? Usually in other supplements, what causes the weight gain? There's one specific ingredient that makes us want to eat more. What is it? Exactly. So it is B12. Because in Cystiphane, we don't have B12. We only have vitamin B6, which directly affects the hair cycle and prolongs the anagen phase instead of B12. And last but not least, it doesn't cause hair growth on the body parts because it has no hormones or no artificial hormones, okay? So it focuses on the hair scalp and the hair follicles on our scalp mainly. So the main 4 ingredients of our Cystiphane tablets, this is how the tablet looks like. It is a yellow tablet, and the recommended daily dose is 4 tablets per day, 2 in the morning, 2 at night, with the meal. We will go through but for now, let's focus on the ingredients. It is L-cysteine, 2000 milligram, vitamin B6, 2 milligram. We are talking about 4 tablets, by the way, those. Zinc, which is 15 milligram, and arginine, 6 milligrams. No other ingredients. This is why we focus on cysteine. We have the highest concentration of 2000 milligram. Yes, very small. Yes, and it doesn't have any taste or odor, by the way. Sometimes, exactly. Cysteine is an amino acid, vitamin B6 and zinc, the minerals, and arginine. Arginine is the vasodilator. Now we will go through the benefits of each ingredient. But as you said, the size of the tablet is very small. It doesn't have any taste or smell because some other tablets, because of the iron inside it, it has a very annoying taste or aftertaste. So after you swallow the tablet, like around 2 hours after that, you can still feel the taste in your mouth. So this is the special thing about Cystiphane. It doesn't cause that at all. B12 also. This graph is very important because this is where I was comparing keratin and cysteine. So they made a study and they tried to give some patients food supplements which are keratin based, and for other patients Cystiphane anti-hair loss tablet with cysteine based. and the main difference was very clear. After like 2.5 hours, we can see the absorption of keratin is still 0. After 4.5 hours, it was still 0. This is why I was saying it is very hard to absorb keratin in our bodies, while as cysteine is dose-dependent absorption. The more we have cysteine, the more the absorption will increase with the time through our bodies. Okay? And it is dose-dependent because the more we increase the dose, the more results we will see. Okay, so as I said, we have cysteine, which is a sulfur amino acid essential for the synthesis of keratin. We have vitamin B6 and zinc. Zinc is also important for sebum regulation. So usually when the hair is very oily or it produces a lot of oil, that causes hair loss. Or if it's too less, by the way, it causes also dryness and hair loss. So this is where zinc comes, and it regulates the sebum circulation. And arginine is a vasodilator, so it opens the vessels to receive more nutrients and to make a faster effect. Instructions of use: we should take 4 tablets daily, as I said, in 1 or 2 doses, but usually it is preferable to take it in 2 doses. So 2 tablets in the morning, 2 at night, after a meal, especially because it might be a little bit heavy on the stomach for some people who have digestion issues, so it's better to be taken with a meal. And with a full cup of water, of course. The main course is 3 months, but it can be renewable. It depends on the case, but not less than 6 months to see clear results. But in the first month, we will start noticing less hair falling down. After the second month, we will start to see the baby hair growing. But it takes 3 months to feel like you fully cured the issue, and we can renew it. And instead of 4 tablets in the renewal phase, we can start taking only 2 tablets. So it is better to be taken, of course, with the 2 Cystiphane anti-hair loss products, which are the lotion and shampoo, to have faster results. As I said, it is no gluten, no lactose, no titanium dioxide, and very low calories because it is vegetarian source. Yeah, these are very important selling points, and especially for weight gain. Mainly women, they really care about the weight gain when they are treating the hair. We don't want to gain weight while we are fixing our hair. So what is the point if we have another issue while we are fixing our hair? So this is a very important point when we mention no weight gain and no unwanted hair on the body as well. So we will move to the lotion. This is we call it lotion because it's a French product, by the way. The origin is France. They call it lotion, but for us it's a spray. It's like the minoxidil spray, but it is not minoxidil. Okay, so it slows down the hair loss. It has a triple action. It increases the density of the hair growth and resistance. The main ingredient here in our Cystiphane spray is called vinephrine. It is extracted from the vine leaves. Yeah, خلاصة ورق العنب. It is in Arabic vine leaf extract. Okay, so it is also natural and plant-based. We eat it actually. We usually eat this. Yes, we put rice in it and we eat it. So now it is. So now the studies show that vinephrine has a very important role in initiating the anagen phase, which is the first phase of the hair cycle. If you remember, anagen, catagen, telogen, and then the new anagen phase. So the vinephrine will be helping in our anagen phase to support the hair grow to be strong and healthy from the beginning. Of course, it has also vitamin B6 and pyrectonolamine. By the way, this is a very important ingredient because it reduces scalp inflammation. So for patients who are already on minoxidil, for example, they suffer sometimes from itchiness, inflammation, because minoxidil is very harsh on the skin. So if the patient does not want to stop minoxidil, it's fine, but they can use Cystiphane alternatively. For example, minoxidil in the morning, Cystiphane at night, or the opposite, because it will reduce the inflammation of minoxidil while also working on the anagen phase. So it is a double effect. Yes. Usually when you stop using minoxidil, the hair will start to fall again. So it's a lifetime treatment. This is the main difference actually between minoxidil and Cystiphane lotion, because Cystiphane works on fixing the hair follicle. We don't work on the hair itself. We work on the hair follicle and the nutrients to fix it so that even when we stop using the spray, the hair follicle is still healthy and it can still grow healthy hair for a couple of other months. The hair will not start to fall again because it doesn't work in the same mechanism. No, because it doesn't work as the minoxidil, as I was saying. We work even with the Cystiphane tablet, we work on the hair follicle to fix the main ingredients of the hair and to fill it up with cysteine and vinephrine as well to make the new hair healthy and sticking to the hair follicle inside. Okay, so as I said, by the way, doctor, you mentioned an important idea about pyroxenolamine for people who suffer from dandruff as well as hair loss. So people suffer from both. We cannot, by the way, treat hair loss if we suffer from dandruff. So first we need to treat dandruff and hair loss as well, and this is where pyroxenolamine will come in, because it is an anti-inflammatory which is caused by the microorganisms which cause scaling or the white flake on the skin, on the scalp. It stimulates the hair growth, of course, and it is oil regulating properties just like the zinc. So here we are working from inside and outside. We want to provide a full solution for the patient inside, which is Cystiphane tablet, and here we focus on the topical treatment. It is water-based, actually. This is why it is, as you said, suitable for both oily and dry scalp, because it has very rapid penetration through the scalp. It doesn't cause oily after use, or like, minoxidil sometimes causes yellow color. So people who use it at night and go to sleep on the pillow, and in the morning you will see like a yellow color. So this does not happen with Cystiphane because it is water-based. It is very easy to be absorbed through the scalp and no need to rinse it. Just spray it and go out, which is very important also for working women. So in the morning we spray it, it will be dry after a couple of minutes and you just can go with your day. For the tablet, mainly for tablet lotion and shampoo, we can use it for the first, second trimesters only, until the second trimester. Yeah, until the second. So from the beginning, yes. But because, as you saw, the ingredients are very natural and safe, and it is tested on pregnant women in the beginning. Pregnant women, their hair gets better, by the way, when they get pregnant. Exactly. So it is until the second trimester, it is safe for the very few percentage which suffer from hair loss. But with the pregnancy, the hair will be great, and after delivery, the hair will start to fall again. And it is safe, by the way, during lactation. Even during lactation, it is safe for the baby. Doesn't have any kind of side effects. Okay. The full range, 3 of them. بأول 3 شهور بس. تمام. So no need to rinse it. It has no perfume, and this is important, by the way. We face this during Hajj season. So for Muslim people who are traveling to Saudi Arabia during the Hajj season, I'm not sure if you are all aware about it, but they look for products which have no alcohol, no perfume. So this can be used during that time. They don't have to worry. They can take it with them, and they can still keep using it. And it is 125 milli, by the way, which is enough for 1 month. Almost, if we will stick to the use of 7 sprays per day for 6 weeks, and preferably in the evening on a dry scalp. After the first 6 weeks, we start using it 1 day yes, 1 day no, so day after day, okay, for the 6 following weeks. If we stick to this, it will last us for 3 months. Almost the 1 pack, and we need to massage it gently and do not rinse it off. Just leave it on the scalp. It will be absorbed. So it is, as I said, dermatologically tested on sensitive hair scalp, and it has very gentle ingredients. It doesn't cause any kind of irritation. Last but not least, we have our hair loss shampoo. It contains zinc, N-acetylcysteine, B6, and hyaluronic acid. This is where we have to focus on zinc first. It is micronized zinc, because usually zinc have a very big particles which cannot be absorbed as well. This is why in Cystiphane shampoo we did it in a micronized way, so it is very, very small particles for easier absorption. And N-acetylcysteine for the same properties, vitamin B6 as well. And the most important is hyaluronic acid, because usually any kind of hair loss treatment shampoo, it causes dryness. And this is why we increase the concentration of hyaluronic acid to increase the moisturizing effect and to prevent the hair from dehydration. It should be used on the wet hair, of course, in the shower. You should leave it for a couple of minutes, by the way, so that it can get the benefits of it. Then you should rinse it with water. It should be used for 3 months. So generally, tablet, lotion, and shampoo, the full course is for 3 months. Okay, and it can be used from 2 to 3 times a week, this shampoo. And please ask your patients to avoid using shampoos with chemicals and like the ones which are sold in supermarkets and online, because you will damage all the treatment plan, especially those who want to use a conditioner. It is okay to use it, but at the end of the hair, like the ends only. Okay, so the conditioner should not touch the scalp. Okay, it is 200 ml by the way, and mainly the price of the tablet is 322, lotion is 290, and the shampoo is 140. So now we will move to the second range, which is our anti-dandruff range. We have anti-dandruff Cystiphane range, which is 2 types of shampoo. One of them is for severe dandruff and the other is for very mild and most common cases of dandruff. On the other hand, we have Ionel T, which is called tar, and most of you maybe you know about it already because it is a really amazing product. All the dermatologists like it, they love it, they see the results from the first use really. So we want everyone to know that it is back. Okay, and the last product is the cleansing gel, which is also directed for antifungal and antibacterial use. So combined together, it will create a full range of anti-dandruff treatment.